Yeah, hello, and I warm welcome again back to KDL TV Live. Very delighted to have you again, wherever you might be watching us from around the world. It is 11:56 a.m. Central Time here in the U.S. It is 12:56 Eastern Standard Time. It is 8:56 East African Time. So very delighted again to have you on the show today. Today, yeah, in our second segment, we're going to talk about preventing and managing COVID-19 within the African immigrant community here in the state of Minnesota and indeed across the world. And we're very delighted to have on the panel today four very wonderful young women who are going to engage in this conversation with a special focus on women and the young people. So today we'll have on the show Hulda Momanyi Itzler. She is the president of the Monyegetinge organization, the largest Kenyan group here in the state of Minnesota. She'll also be joined on the panel here with Dr. Mary Ann Menge. She's a pharmacist by profession and a life coach, and she'll be talking about that at the same momentarily. And again, also welcoming back to the show, Sally Eteka. She's been on the show before. She's a triage nurse, so she'll also be giving us a professional perspective. And also joining us from California is Biola Momanyi. She is a healthcare administrator, and they'll be helping us really dissect how the COVID-19 is affecting the African immigrant community. And so very happy to bring them on the screen right now. So, ladies, it's good to see you. May I first begin to say that you all look great. Whatever you did your hair, I will need to know that so that I can take my daughters there later today. How are you feeling?
Great.
We're feeling good, Dr. Harry.
Good. Thank you. So again, before we get into the niche details of the discussion, if you could please, let's begin with a quick introduction of who you are. And I want to start from the top left on my end, Dr. Menge.
Yes, my name is Mary Ann Menge. I just graduated from pharmacy school, and I appreciate life coaching and health coaching. So if anyone has questions on how to live a healthy and happy life, reach out to me.
Okay, that's very good. Good to have you on the show, Dr. Menge. Also, to the left on my screen, Sally Eteka.
Good morning, everyone. Thank you for having me on KDRTV. This is not my first time. I'm a returning educator into this program. My name is Sally Ateka Gesembe. I'm a triage nurse working with the rapid response team, and I'm a care coordinator and OB educator. Thank you for having us.
Welcome back again to the show, Sally. And in a moment, you will tell us what a triage nurse means. I don't know what that means, but you will help us understand what that is. Thank you again. And then now let's jump over to California. And then we have the younger Biola Momanyi.
Hi, everyone. I'm happy to be here. My name is Biola Momanyi. I graduated last 2019 spring with my master's in healthcare administration. And right now I currently work at Keck Medicine of USC out here in Los Angeles. And I'm happy to be here to talk about such an important topic.
Oh, very good. Good to have you, Bill. And I tell you what, especially those of us here in Minnesota, we feel jealousy. We want to come down there to LA, but that's something for after the show. And then back home here in Minneapolis, we have Hulda Momanyi Itzler. She's been on the show many times, and she's doing an incredible job for the African immigrant community here in the state of Minnesota. Hilda.
Very good morning to everyone. Thank you, Dr. Okari and KDR TV for hosting this such an important topic within our community. Thank you to Monyegetinge organization for partnering with KDR TV to bring this information out to our community. Once again, I am the president of Monyegetinge, a Kenyan immigrant organization that really fosters to bring resources and information to our community for a better life, not only here, but also our families across whatever they are. So glad to be here this morning.
Thank you, ladies and Hulda. Thank you again. Good to have you. I mean, again, you're doing a great job, and as we'll be talking here momentarily. So it's good to have you on the show. But first, let me begin by thanking you for willing to come on to share your perspective about COVID-19. And then secondly, I want to also appreciate you. Obviously, we have many problems within the immigrant community, as you must have had in our previous discussion. But I think what you have done individually is recommendable, and I think it sends a very powerful message to especially young girls that regardless of the challenges we face, our girls can go beyond and really make us very proud as an immigrant community. So again, many thanks from us here at KDL TV. So let's get to you first. Mary Ann, pharmacy is not my area. and we are so proud of you for taking that route. And I'm sure many young girls watching you today will really have a good appreciation of what it is to be there, and then all probably do as proud as you have. So let's begin with you, if you could share with our viewers, when we talk about COVID-19, please, in a language understandable to our audience, what are some of the key signs and symptoms?
COVID-19 is it's a viral infection, and it's an infection that, just like any other, affects the immune system. And so some of the symptoms that have been reported, and this is directly from the CDC website, and they do a lot of intensive research, is that a lot of times one will have dry cough. You will have fatigue, which means feeling very tired, not of yourself, loss of appetite. One of the biggest one is having a generalized body ache. You just feel as though you're not yourself, and you're just beginning to have some pains all over your body. And then the other thing is just having that feeling of shortness of breath. And if things are really getting to a higher level, the fever will be way too high, above the 37 degrees Celsius, which is the normal body temperature, and moving off to, sometimes it can, if not well attended to, it can become pneumonia. And for children, they mentioned that sometimes children may end up having an ear infection. So look out for those symptoms. But just before we get started, I want to give a quick comparison to what this looks like. This pandemic is similar to, it's not quite similar, but it's similar in history to what we had, which was the Spanish flu. And so just like we see, it's a flu that has symptoms of, it's a flu-like symptoms, which is a viral infection. So if you really want to see how COVID-19 will take root or precedence in our society, let's take a look at the history of what has happened in the prior pandemics. So with that, I'm just going to say dry cough, fatigue, fever, loss of appetite, generalized body ache, and the sore throat just feels like you just have a very dry sore throat, and it's not getting better with any over-the-counter products. Thank you.
Thank you, Mary Ann, for that contribution. And then I'm going to bring in here Pila as well. You know, luckily you just graduated from school and you're working as a healthcare administrator. That's good. Congratulations. If you don't mind, also share the same. What are some of the signs and symptoms, as you know, for COVID-19?
Yeah, definitely what Dr. Marianne mentioned. All of those are some of the really highly reported symptoms. Those could range from very mild to very severe. Definitely one thing I want to add to what Dr. Marianne said is the kind of emergency warning signs for COVID, when you should really, really be reaching out. And it's an emergency that you need to go and seek emergency cares. If you find yourself having trouble breathing, if you have persistent pain or pressure in your chest, or any sort of kind of new confusion, if you feel like you're unable to stay awake or to wake someone, or if you can tell this other symptom, bluish lips or face, if you can notice any of those certain symptoms, those are emergency warning signs, and you should seek care immediately. Again, these are symptoms that can be mild or severe, and it's something that hits, not only older adults, it's people who are just in middle age, it's youth. We're seeing it all through the spectrum. So definitely keep an eye out for that.
Thank you so much, Pila, doing a good job. And by the way, what we're seeing at your background there is a good representation of a proud daughter of Africa. I like the art, and I'm sure our viewers will as well. So let's get back to Minneapolis as well. Sally, you've done a lot of this, particularly the youth and the church, and you're in school just about to finish your nursing professional position. If you don't mind, also, you want to add on to the same?
Yes, in addition to what my colleagues have given the signs and symptoms of COVID-19, in specific to the children and young adults, the symptoms that we see mostly are sore throat, runny nose, congestion, abdominal aches, and pink eye or red eye. Some of the symptoms like nausea, vomiting, and diarrhea, but most prominently we see chest pressure, symptoms like asthma-like symptoms. And there is a new episode of confusion or brain fog or a skin rash, especially in children. And that can be confused as normal, like, oh, this is just a skin rash or eczema. But once tested, what I found, especially with the children, if they come with symptoms of a sore throat, we may confuse it with a, a, a throat infection, or just go test them for strep throat. But once they test negative, we go ahead and recommend testing for COVID-19. And for sure, as Dr. Marianne said, those flu-like symptoms now have turned to be COVID symptoms. And also, this infection mostly affect the airway, especially the lungs and the blood vessels and breathing organs. So, and it affects different people in different ways. Thank you.
Very good. Thank you, Sally, for that contribution. So let's bring Olda in. Olda, we brought you in so that you can give a community perspective. Obviously, these are professionals. This is what they do on a daily basis. But you're also strategically placed within our community so that you have a good view of what's happening in the community. You have a perspective of how the community is feeling and dealing with this situation.
Absolutely, Dr. Okari. And obviously, I'm not a health expert, so I'm definitely not going to try to add to what the experts have already stated. But what I want to point out in regards to the community aspect of this is that what we need to realize, as one of the young ladies stated, is that this COVID-19 is not only targeting a certain category of individuals, it's across the spectrum. You know, obviously, some of us are aware of how hard our community has been hit. Just recently, we lost a young man, a family man who was not barely even in their mid-30s. So that goes to show you that this pandemic and COVID-19 does not discriminate, when it comes to race, age, gender, you name it. And that's why within our community, we are still battling, trying to contain this this pandemic because of our cultural traits. We are a community-based, people where we love to gather together, where we love to come together and fellowship and really, as a family, be together. But unfortunately, this pandemic has made it very difficult, and you could definitely see the toll that it has taken on our community, not only from a family unit level, but as the entire Kenyan community here in Minnesota. And we have definitely had many deaths that have been related to COVID-19, and we are still grappling with this, and as the experts are saying, we are not out of the dark yet in terms of decreasing the numbers of COVID-19. Yes, the vaccines are on the way, but still, we are seeing a large number of our community being infected each and every day, and at the end of the day, we still have to continue, sticking with the guidelines, whether we ourselves like it or not, because I know that it has been a long time coming, in terms of going back to normalcy. But again, what does normalcy look like, now that we have this pandemic? So at the end of the day, our community is still struggling, and we're still fighting to make sure that our community gets what it needs from a basic needs perspective, and then from a pandemic perspective as well.
Thank you, Hulda, for the good work you're doing. And I think I take a moment to appreciate the entire leadership of the African immigrant community, especially here in the state of Minnesota, and particularly the Kenyan community. I think for once in a very long time, almost 20 plus years that I've been around here, I've seen Kenyans and Africans really come together. I think that's the spirit that we really need going forward. I think you, as well as the leadership within our community, many thanks to you. So, and I think part of what we're trying to do, whenever we have somebody, quote unquote, sounds and look different, sometimes the language might not be received as intended. And that's part of why we have you as a panelist to use a language that is understandable to our community. So let me get to you, Pila, if you don't mind. Hulda is talking about a young person dying because of this in early 30s, but as early on we are told, no, this was meant for the elderly. But indeed, now it's happening that even the young people are dying out of this. So, if you don't mind, speak to our community directly. Does it affect the different demographics, young, old, gender? Does it affect them differently? If so, how?
Yeah, I think what Hulda has just shared is spot on. COVID doesn't discriminate. Obviously, within some of these populations, and in particular with our community, just the rates may be different depending on what population we're talking about. As you probably know, just within our community, especially here in the States, we have a high number of healthcare workers in our families. I know, in particular, in my family, both of my parents are in nursing. Lots of relatives in medical professions or just essential workers. And so the thing to remember, especially with those populations, is that they are caring for vulnerable populations. They're caring for or just serving a lot of people. And so there's a high risk of getting exposure to COVID just by the nature of their work. And just the thing to remember within our community is that, it definitely doesn't discriminate. It doesn't pick and choose and say, oh, this is a youth, so as COVID virus, I don't affect you. And although even with children, fewer children have been sick with COVID compared to adults, children can still be affected by COVID-19. They can still get sick from it and they can still spread it to others. And so even if they don't have symptoms, this is still something that can impact the family as a whole. And unfortunately, we're seeing even some children get severely ill from COVID-19 and require hospitalization or intensive care or even a ventilator. And it's really important for you to understand and get in touch with the medical professionals in your life, your doctors, your child's doctors, in order to understand how you might be impacted, and in particular, those with underlying conditions. And a lot of times we're seeing it with middle age to older population within our community having some sort of underlying condition like diabetes or a heart condition, and so on and so forth. And so it's not necessarily unique to a certain population. It's more so understanding how it impacts those with underlying conditions or the elderly. And right now, I think it's important, in order for us to keep everyone safe, that all of us treat it like it's something that we can all get and something that we can all be physically, we can all have physical symptoms from. So yeah, I really think it's definitely important to address those who are more vulnerable to catching it just by the nature of their profession, but definitely doesn't affect different people differently.
I think thank you for that perspective. I think those ones watching, you might pay attention closely, especially when it comes from one of our own. I think it's important that we take seriously this issue. So, Sally, I want to bring you in. For those ones who don't know you as we know you, you are very soft-spoken, but in terms of your contribution to the community is massive, really. Look at what you do in the church, particularly the young people, is massive. In the healthcare industry, you do a great job. So I think even in the political process, you are very involved. I think most people see you as soft-spoken, do not know that you make that massive contribution as well. From your conversations and your experience, does it affect really people differently?
People differently, and it's very important to note that anyone can spread this infection once they contact it. So how do you contact it? So an infected person spreads it through droplets. At the beginning, CDC, World Health Organization, through research, we did not have enough information on how this virus was being spread. So information came back and forth, and with research now, we've found out that it's spread through droplets, and it's by cough, sneezing, and breath. So if you are in close contact with someone who has that virus, you are likely to be exposed, or you are exposed. And if your immunity is low, as Bula said, you are likely to be either a carrier or actively having it or contact it. So on average, the people who are exposed, they start experiencing symptoms between 5 to 7 days after they're exposed. Or it can occur between 2 to 14 days per studies from CDC. And it's very important to note that asymptomatic people are those people who are carriers, they have it, but they do not experience any symptoms. These are the group that is very contagious. I got it, but I got it from my children. And they were sick only for one day. They experienced a headache, a running nose, and cough, a little cough. And so I thought, oh, this is strep throat. Let me just take them to be checked. And when it came back negative, they said, no, we have to check for COVID-19 because many kids now are carriers. Dr. Kari, the community, as a community, we have to be really informed, especially families. We should not take it for granted that it's only the elderly people who get the condition, because before from either in other countries like in the UK, the information we get was those people who have a poor immunity are the ones that are contacting it, or the people who have an immunocompromised condition such as diabetes, obese, asthma, and heart conditions. But now it's community. Everyone can contact it, and it's spreading, and we are not out of the hook yet. So we should be careful. Young children, middle-aged women, this is not something that we should take lightly. It's very important to note that compliance is the key to preventing this condition.
Thank you, Sally. And in a moment, I'll bring Ul and the great job they did yesterday in Brooklyn Park, and we'll share a few videos and pictures of the good work they're doing in the community. But I want to stick with Dr. Marianne. And by the way, Dr. Marianne, just a quick reminder to our friends, you do 1 or 2, 3 videos on your Facebook page. I think after this show, those ones who want to go on and watch, it's great. I have watched them from the beginning to the end. They're very well thought through. So if you don't mind, share the same to our viewers.
Everybody has said COVID-19, I will reiterate, it's a viral infection. Let me just go a little bit on what a viral infection is. A virus is one that does not discriminate. It takes the form of the DNA of a human being, and that's why it's very specifically difficult to treat a virus infection. Because if you're going to, to target a virus, you're also targeting the very the very molecule that's creating and sustaining a human being. So that's why it's very sneaky, and we need to take all of the necessary precautions. And the best way, one thing about a virus is that it does affect the immune system. That's why every human being has immune system, and so everybody's prone to get a viral infection. So the biggest thing is to make sure that your immunity is up on point. That is making sure that you are eating nutritious food. Make sure you are eating nutritious food, and I reiterate that. A lot of times we just want to do quick fixes, which is not really helpful. The body is being deprived of the very same energy and sustenance that it needs in order to protect us and do its job. So get your immune system high as best as you can. Some over-the-counter products, I love talking about over-the-counter products. Some over-the-counter products that I've seen a lot of people coming in to purchase are the emergencies. There's the elderberry. There's the vitamins, just any regular vitamins, and also most importantly, vitamin D. Vitamin D is important, and calcium as well. Vitamin D and calcium are important in helping the process of breaking down of some of these molecules in order to aid the body to do its job. So it's important to, get the necessary information that you need. One of the biggest disadvantages is that this pandemic, COVID-19, has happened at a time where we were not very well prepared. And so the information we are getting it's on an ongoing process. So it's good to be on top of what's happening. The CDC is continuously providing free information. Just log in or just go onto the website and try to find as much information as you can. On top of that is that the vaccine now is out. Some of my colleagues, my professors have already gotten the vaccine right now. Some people may be hesitant to get the vaccine, but take the time to understand the risks and the benefits of getting the vaccine. Just like I mentioned earlier on, we had the Spanish flu that came in and it spread throughout the whole world, and now it's just a regular flu. We get the influenza vaccine that's helping to protect our bodies from getting the flu. There's always various different strains of the vaccine, but at least it does help reduce the effect of getting the hard pain of going through the symptoms and suffering through the flu symptoms. So similarly, assess the risks and the benefits of getting the vaccine before people put in their thoughts of not wanting to take or taking the vaccine. On top of that, I just wanted to add that with time, it's already a year now, and we are beginning to uncover how this COVID-19 is affecting everybody. Children are carriers, but some time back, we understood that children even below 5 years of age have passed away due to the COVID-19. Now, elderly are obviously more prone to it because of their immune system and maybe comorbidities as to some of the diseases they have. So, it's just about taking care of yourself and having someone else's back. This is a time where our true responsibility to ourselves and to the community has been tested. So if you have COVID-19, what the public health and other institutions have done are to make sure that they provide food supplies. They've made sure to contain the disease to the same environment that the person is that's suffering from that, and also further to ensure that they're comfortable and provide them with support that they need. So there's ongoing support. So if you are at a workplace and you identify that you've exposed yourself to someone who potentially had the COVID-19, or you had the COVID-19 and potentially exposed other people to having this disease, it's important to self-report yourself in order to protect other people, because they're also making themselves available to provide services to others. So this is more like a self-check responsibility type of a situation that has been brought on by COVID-19. And so something that we haven't mentioned yet, it takes a span of 14 days to either go through the symptoms, for the symptoms to reach its peak, and then from reaching its peak and then to subside if someone is beginning to feel better and they're doing the necessary self-care that they need to do. So since we're still learning and experiencing this disease, the best thing I can say, just to summarize, is to take full responsibility of yourself and take full responsibility of the people around you and the community at large. Thank you.
I want to stick with you quickly here, Dr. Menge, if you don't mind. You guys, the three of you, you're experts in the area. You might be using some terminologies. It sounds easy for you, but some of us, it's very foreign. So a quick list, for example, when you talk about vitamins D and C, what does that entail?
Oh my goodness. I wanted to bring the samples, but since I'm not advertising for them, it's good to just go over the counter near to any Walgreens, or for those in the European countries or whoever can access this, go to over the counter near the pharmacy and you can get the products there. First of all, vitamin D is, how well can I describe this? Beulah, you can jump in at any point. So the best thing is it's the product of what we get from exposing ourselves to sunlight. But half of the time people are super, super busy and they find themselves not having the opportunity to get that direct sunlight that they need. And actually, if you get the time to get the vitamin D, the 9 a.m. and the 3 p.m. sunlight is what is recommended. So vitamin D is important in the body, that it's responsible for being present for some of those reactions, or for some of those ways that the body is using to recreate the energy that we need and to sustain ourselves, and which is also important in also developing immunity, first of all. So vitamin D, as simple as it seems that it's present in our skin and we expose ourselves to sunshine and then it just, built itself, is important to supplement from what we have over the counter. So what is recommended is about 10,000 units. Like that is getting the best maximum amount of the amount of vitamin D that we need. Sometimes they recommend less than that, but usually for some of the researchers that I've looked at, they say 10,000, and you can never really get too much of something. When the body has gotten enough, it just washes the rest of it away. It knows how to self-clear. So go ahead and take those. Calcium is also good for our bones. Research is still being worked on to understand how these molecules work together to develop some of to sustain our body. But mostly, we are looking at creating and sustaining your immune system to a level that it's just helping fight off of these diseases that are necessarily bringing themselves on us. So that's what I'll say. Did I make myself clear on that one?
Very, very. I'm impressed. Actually, this is exactly what our community needs. The very best of us sharing their experiences and knowledge. This is massive. Sally and Pila, if you don't mind adding to the same, also on who is most at least, as the young guy talks to Mami Uda in a moment there. Sally.
The people who are most at risk, everyone is at risk in this case. Anyone can be affected. Like my colleague said there, the COVID-19 virus does not discriminate. So the people who are most prone are the people who have a poor immunity, those with compromised conditions, and those ones who are frequently exposed. For example, the healthcare workers, the frontliners, those ones who are carriers, such as the young people and children, because they can spread it due to the high rates of transmission from one person to another. And they are in the community, the people who live in congregate areas, like the places that we congregate, like church, sports activities, family members, overcrowded areas. As immigrants, we are known to live as a communal. We follow the Eastern way of a lifestyle where we live as a community, grandparents, cousins, relatives, aunties, brothers, and sisters. So that can expose us. If one person goes out and is exposed, they can bring it home. So due to the lack of research before, at the beginning, we only had information that the older population were most vulnerable. But now we have found out that since the virus is in the community, everyone, all ages of people and populations are equally affected by COVID-19.
The same question, and as you do, with a special focus on especially young, you're very young really, and particularly women. There are those ones who say, based on what Dr. Meng and Sally are saying, some say, oh, you know what, this is for the elderly, therefore it does not affect young people. Or, you know what, this affects Black men, it has nothing to do with young women. Who actually is at risk based on what you know and what you've seen?
Yeah, I think that.
Go ahead, Pila.
Yeah, no, I was just going to add on top of what has been already said that, like has been said, anyone can be at risk, but definitely there are those with underlying medical conditions like heart or lung disease or diabetes. Those might be at higher risk for developing more serious complications from the COVID-19 virus. Again, anyone can have mild to severe symptoms. And we're also seeing that babies, especially those 1 year or younger, might be more likely to have severe illness from the virus as well. And other children, again, with those same kind of underlying conditions like asthma, chronic lung disease, diabetes, obesity, and any sort of kind of heart disease or medical conditions, or even those just taking medications that weaken the immune system. I definitely think that is something to keep in mind, and especially in our community that just been stated, it's really important for everyone to take this serious because of the fact that as our households. A lot of times people don't live by themselves. They live with their parents that they're taking care of. They have young children. Those children may need to still go to school, maybe even 1 or 2 days a week. And so there's so many different ways for this virus to enter our household. And for the most part, a lot of us, if we ourselves are, relatively young or healthy people, we're surrounded by people who do have these underlying medical conditions or who would have severe reactions to this virus. And so it's important for us ourselves to treat this seriously, that, not even looking at how it might affect ourselves, but looking at how it might affect the people around us. And so I think it's important to look at those who are at risk, but also realize that we don't even know the people around us if they are in those more high risk categories. And so we should act like it is, just so we can make sure that we're keeping ourselves safe and we're keeping our community safe.
Very good. Thank you, Bill, for that perspective. Hulda, in a moment, you're going to lead us into the next segment. But again, Dr. Menge, you had a point to make there.
Yes. Well, I just wanted to mention that I lost my train of thought, but it's important to look out for each other in the community at this time. Just to go over that, maybe the biggest thing that has come out is we're fearful about what's really happening. And I've seen a lot of people not even wanting to come out to do anything. So the biggest thing is it's good to be careful, but not to come off alignment with not wanting to do anything because you're paralyzed by the fact that you are fearful of getting this disease out there. So it's good to continue on with your personal life, but also taking the necessary precautions to protect yourself, to protect your family and the people around you. So I just wanted to mention one other thing is we need to realize that one of the biggest things that's causing the low immunity is stress levels. So one of the biggest things that happened is once this pandemic happened, a lot of people were told to go home, which was, to me, was a first step in healthcare, self-care, because a lot of times there was this continuous routine of people continuously going to workplaces. Some of them have mentioned to be stressed and unhappy of their work situation. So the level of stress was high. So if your stress level is high, potentially your immune system is going to be compromised in some way. So we need to take the idea of staying home as a protective mechanism to rebuild ourselves and to rebuild our immunity. One other thing I want to bring on is that sleep is very important. When you are sleep deprived, the body is not getting enough time to rejuvenate itself. Typically, even people who have cholesterol, it's recommended to get enough sleep because that's when the body starts reshuffling, reorganizing, and rejuvenating itself. So one big thing about this around this time is when you're told to stay home, take that opportunity to go home and really take care of yourself, do the self-care that you need, but at the same time, eating nutritiously and improving your immune system. So, just appreciate everything that's happening. Thank you.
I know, Hulda, you receive calls on a daily basis about all this. You want to add the same before you lead us to the next segment?
Absolutely, absolutely. So I want to echo what Dr. Menge and what Beulah has stated, as well as Sally, that the underlying problems, right? Like the biggest population, let's be honest, that is being hit is Black people and African American people, right? The African population. A lot of times, we ourselves, do not have good healthcare. Let's be honest. We don't take care of ourselves like the way we should, working out, eating healthy, like Dr. Menge said. And so we already are prone to this underlying issues that the experts have talked about. And so that's why we have to take that initiative to take extra measures in order for us to prevent ourselves as well as those around us from getting COVID-19. I mean, if you look at, I can only imagine the statistics, when we're seeing the majority of the population who are, ending up in ICU, what does that population look like? And then also, with our with our socioeconomic status as Black people and as African and African Americans, we already have a lot going against us. And so this is just another thing that really shows the lack of healthcare, resources that our people are not getting. The types of healthcare support that we need is not there for our community. And that's why we are seeing a large population of people are really affected compared to other demographics. And this is something that our experts can add on if they are seeing those trends within their respective workspace.
So thank you, Hulda. And what we are showing there is the executives of Mwanyagitinga organization, a group here in the state of, for those who's actually watching from other parts of the country and around the world, here in the state of Minnesota. And I think it's also good to take the moment to acknowledge what the Kenyans here in the Twin Cities especially are doing. I think, like I said before, more than for the 20 years I've been around here, it's the first time I've seen Kenyans come together, and I think we're very, very united in a way that I've not seen. I think we want to give a big shout out to all community leaders for bringing us together, and more importantly, particularly to experts, for you guys coming in and trying to give your very best perspectives. Now, Ben, whenever you're ready, let's show what the Mwanyagitinga organization has been doing, and particularly what it did yesterday. If you are able to bring that on the screen, are you? Okay.
Hello, community. This is Hulda Mumanyi, your president of Mwanyagitinga. I am here at our big event. Today we had a food distribution. We have free COVID-19 testing, as well as passing out some PPE equipment. So I'm so glad to have you guys. We had about a large number of people turn out to register and also sign in as members. So they would start here, and then they would come through here and meet with my secretary to pay their membership fee if they are not members. And then after that, we gave them a bunch of PPEs, masks, hand sanitizers, face shields, and then they would proceed to get their COVID-19 testing. Once again, community, we appreciate your partnership. We appreciate our volunteers, as you can tell. And I want to say it was a successful event. Thank you.
Okay. Great work, Madam President. I think that's a message to our community in the state here and also around the country. I think whenever we do these things together, we tend to do good. And I think we're in very good position. Ulda, I want to stick with you for a moment. You did mention, and again, with the numbers the experts are giving here, with that, there are also stigma and stereotypes within the community as to who really is affected. And I think some of it has been really detrimental to especially the elderly. If you don't mind sharing your perspective on that end, are there stereotypes within the community that we should be concerned about?
Absolutely. So before I share that, I want to emphasize on yesterday's event. So we served about 213 people who came by and received food distribution. And then we had the COVID-19 testing with partnership with Hennepin County that we were conducting as well. And then the PPE that we were supplying to our community. The whole point is to definitely address COVID-19 and how hard it has hit our community. And so to go back to your statement in regards to, the stereotypes, I think what I'm seeing within our community is the lack of understanding on what's out there, what's possible, and what resources are out there and information in regards to COVID-19. Because yesterday we had the COVID testing and a majority of our population, again, are in healthcare. And luckily for us, from that perspective, we are able to have a large percentage of our population who are in healthcare getting regularly tested. So that is huge in light of having our people knowing whether they are positive or negative for COVID-19. But for yesterday's event, I got a lot of pushback in terms of the testing style that was being done. That's going up the nose, and that's very uncomfortable, right? And so I got a lot of pushback on that. But at the same time, again, it's a matter of understanding our community, right, and our needs and what's comfortable for them. So what we are doing to address more increase in COVID testing is that we want to bring our own experts who are trained to do COVID testing and provide other various types of COVID testing ways so that it's not just our one option. So people are comfortable with the testing itself. And then after that, we want to make sure that we address, information regarding vaccine, the recovery effort of COVID-19. So when we go back to, again, your question regarding the stigma within our community, it's a matter of the information and making sure the community has accurate information in regards to this topic.
Thank you very much, Ulda. Sally, I want to bring you in for the fact that I know you do a lot of work within the community, whether it's in church, in your business organization. What are some of the stereotypes that you've noticed, and how should we address those?
All right. There's a lot of stigma about COVID-19. And it's very important to note that stigmatization means blaming and shaming a certain group of people for contracting the pandemic. But we need to know that this poses a threat to everyone else living around you. So, for example, we should not be, branding people or labeling people, oh, this is a COVID case or a COVID person. At the clinic or at the hospital, we learn about ethical ways of addressing the patient. We're supposed to say a patient who has contacted or a patient who is exposed, a patient who is vulnerable, or a patient who was tested positive for the infection. It's laboring and discrimination against makes people not to come, especially our African Americans patients. It prevents from seeking the health care that they need. And a study from CDC means Center for Disease and Prevention. It states that it discourages people from adopting the health behavior. So, for instance, they will hide it, and they will not go to seek for health care because they know that they are discriminated against. It's true, Dr. Menge said we are infected, but in as much as the research shows that the non-African American are reported to be close to 80% in the hospital, but those who die, the larger percentage is African American. So it's very important to educate ourselves about COVID-19 and advise those who are around us. We can start using medias like this. Dr. Perry, this is very important that you're giving us a platform like this to channel some of these important issues and educating people, speaking out against the stereotypes in different groups where we are leaders, or we can start with our family members, our friends in the community in different capacities that we serve at church, at various social groups to educate people the right information. And as leaders or as community members, as families, we need to avoid speculation and be well informed so that people don't die because of a lack of knowledge, as the good book says. So talking about it will also prevent the stress and the depression, like Dr. Menge said, because people will withdraw and not be able to share. So we need to look out for our friends. We need to look out for our families and give them the support so they don't fall out into depression. Thank you.
To you, Dr. Menge, in a moment here, but let me stick with you, Pilar, for a moment. You are a healthcare administrator, and what I've seen in the community, this is unfortunate, though. People are saying if you feel you have any symptoms of COVID-19, please don't go to the hospital because that's the best way you're going to jump into your grave. How do you strike a balance? Is this what you have seen from your end, or how do you strike a balance between people really going to the doctor and really staying home and taking care of themselves?
Symptoms? Can you hear me? Okay, awesome. Sorry. Just wanted to make sure. Yeah, if you're not experiencing any of those that I listed earlier, that are those emergency symptoms, in particular, if you are having difficulty breathing, if you are having that persistent chest pain or pressure, then definitely, as you all probably know, and that's on the news, it seems like every day, our health systems are really, taking a hit in capacity in the ICU rooms, and beds. And so it's really important that all of us as a community, as a whole, as a nation, as global community, we're really mindful of that. And so if you're able to have those symptoms and you're not experiencing any of those emergency symptoms, do your best to stay home, do your best to quarantine yourself in your home, and really kind of separate yourself from anyone else who might be in the home, and take care of yourself. Take some of those over-the-counter medications that have been promoted by healthcare professionals to treat some of those symptoms. Do what you can to stay at home unless you have any of those really emergency symptoms. And I would also say, before you jump and go to the ED or go to the ICU, definitely reach out to your own doctor, your own personal doctor, and see what they have to say. Let them know what's going on and how you feel, and just reach out to them so they can keep tabs on you, because they'll have kind of your first line of defense on what you should do before you go to an ED. And so definitely don't hide it. Don't think that if you feel like you have those emergency symptoms that you're scared to go to the hospital. Get that necessary treatment and that necessary care if you need it. Don't be ashamed to do that. There's nothing shameful about seeking treatment. But yeah, definitely just be mindful of how you feel, and kind of go and seek those lower level tiers of care before you go into the emergency department.
Thank you, Pilar. I want to bring you Dr. Menge again. We're going to put a lot of spotlight on you, if you don't mind. So here is a concern I've seen and I've had, because we've done a lot of these segments, and part of what we've seen, you're obviously an expert in this area. Well, there's this doctor they call Dr. Google, right? There's a serious concern about Dr. Google. How much information can we get from Dr. Google? And then the second part of it, there's peer influence. There are many people who say, we call it, in a community, there are always opinion leaders. So people tend to look up to some people to give opinions, but those people are really not medical experts. Now, from your end, what do you advise people, particularly when they're really seeking opinion from opinion leaders and or that medical doctor called Dr. Google?
So one thing that just popped up as I was reading some of the comments is to make sure that, that anyone with blood pressure should not take high levels of vitamin C. So that is a good point that was brought up, and it's important to always run things by your doctor or by your pharmacist. They know how the medications work, and they know how they are going to be influencing your body. So it's important to run everything by your doctor. People are individuals are taking various medications, and they do have drug interactions, even sometimes with just some of the foods that we eat. Let me just bring up a very good point. Like the milk that we personally recreate at home. I don't know how to describe that, the fermented milk. It does have some drug interactions with some of the foods some of the medications that are being dispensed. So it's important to bring some of those important points to your doctor. Ask what are some of the medications or some of the foods that can react with this. So even though Dr. Google or ask Google is a good point to go always find information, there are evidence-based practices, which is research-based, which are guidelines from some of the biggest organizations that provide information daily, either for free to medical providers, or sometimes free to the public and the patient. Sometimes the manufacturers are providing the packet guides or like the packet inserts included in all of the medications. So it's always important to look at those packet inserts. Google has, we have to be careful about the branding, because people are out to look out for themselves. They want resources, they want money. So they will find or latch on any type of information that has been provided, and then they'll amplify it to make it look good and sell it to you. So it's important to always work with your doctor and to find out more about what's happening, even though you have a feeling that would work. But one thing I know that you can never go wrong is eating the appropriate and the right nutrition. And I insist, nutrition, you can never go wrong with that. So someone should research information, because you are providing your body with a highest level of best product possible, and it's going to use that to build itself. And secondly, when it comes to peer pressure, one thing that's happening is that the spread within the youths has been very high, because everybody wants to connect. With COVID-19, there's this separation and everybody should stay home. So for most parts, there's that need to get back and connect with people. Something to do to explain on that is that connection is one of the fundamental basic human needs. So with COVID-19 and having people stay at home, it's really creating that divide and separation, and potentially maybe breakdown of relationship, as we've seen. So people will gravitate towards getting back together. Even though people are getting back together, there's that instance of staying 6 feet away from the other person, just taking the necessary precautions, or not staying in a room for too long a period of time when someone is having the COVID-19. Wash the rooms. I ended up cleaning the walls in where I live, cleaning all the doorknobs, cleansing my clothes, and making sure that everything is cleaned as continuously. Because when you go out there, you don't know what lacks on your clothes or what someone else is spread to. So stay 6 feet away. And just to add on stigmatization, it's just simply lack of information and the sheer denial that people just don't want to accept the fact that there's a prevalence of COVID-19. People have died from it. Some people have gone through the symptoms of maybe, emerged not being affected by the COVID-19, but still it's important for us to come into terms with this. Just to add a point is that just the other day there was news on an organization where a Black doctor or a Black scientist was involved in helping create the vaccines. So now there are various hospitals who are doing some dances and doing some things to invite and encourage African Americans and minorities to come to the hospitals in order to get the vaccines. There's always that stigma and lack of trust between African Americans and the healthcare system because of what happened way back. I don't want to bring that up, but just sheerly, I'll say the Tuskegee project that really affected a lot of people. So it's created a lot of mistrust, and so bringing people on and encouraging them to take the necessary precaution is going to be an effort for everybody, especially in the healthcare system, to start recreating that trust for everybody, especially the minority, and to welcome them. And for those who do not have their insurances, please, the government does provide healthcare insurances. It may take some time to actually get through to get that insurance, but there's benefits to going through that struggle and challenge to do that application. So take the necessary precaution and do some serious self-responsibility and self-care. Thank you.
So I'll get to you in a moment. Talking about self-responsibility, I also want to make sure we respect the opinions of the viewers. And there is a question. People are scared of going to the hospital because most of them don't come back home. And we've heard there is an homemade concoction, which is safe and effective. What's your take? And I'm going to start with you, Pio. And I think this is a concern. I think I've seen so many videos circulating in the social media suggesting that so-and-so went to the hospital and actually never came back. So pretty much if you start coughing at home, the moment you mention going to hospital, pretty much people are telling you better write your will before you go to the hospital. What's your take on that, Pio?
Yeah, I think it's a really important question to address, and I think it's something that's on a lot of people's minds. I definitely think that it's really important that when you're going through this, when you start experiencing symptoms, to reach out to a healthcare professional, reach out to your regular primary care physician. That way, as you're going through this journey of the different symptoms and the severity, if it does keep increasing, you have someone who's giving you actual, real evidence-based information and treatment and medication and referrals and prescriptions if needed. And so when you get to a point where you do need actual care that's provided from a hospital. It hasn't been that you've been waiting at home for weeks and weeks, and you could have gotten that care at an earlier time that would have had better outcomes and possibly not, death. And I think, if you're waiting at home and you're experiencing these emergency symptoms and you're just waiting and waiting, by the time you feel like it's last minute and you need to go into the hospital, there's only so much that they can do at that point. And so it's really, really important for you to get early care as early as possible, so you can have that doctor that's like, at this point, I feel like there's nothing that we can do at home for you. And so you need to come in. And so you can get treated earlier. And ideally, with that earlier treatment, have better outcomes, and you're able to eventually come back home. And so I think that's really important to keep in touch with researched and medical professionals. When it comes to this homemade concoction, just from what I've seen on social media, definitely, unfortunately at this time, we are seeing people who are taking advantage of this situation to come up with things that may not be research-based, that may not be evidence-based. And so it's really important, again, especially with social media, to share valid information and to share information that has been tested, that has been researched. And so anything that you can't confidently say, this has been backed by professionals, by people who actually are experts in their field when it comes to viruses, when it comes to treatments, then I would say definitely do not go with those recommendations. And if at the end of the day you think it might be a good idea, the worst case scenario is that you just take that advice and you take it to a medical professional, and they can tell you yes or no. They're the experts in our field, not necessarily, influencers or people who are social media opinionists. And so I think definitely if you're thinking about taking that and you think it might be safe and effective, worst case scenario, I say just take it to a medical professional and see what they have to say about that.
Have Dr. Menge and Sadi in a moment. I'll get to the two of you. And by the way, as I bring you in, Holder, it's important also to take this opportunity to underscore what we're doing here as a diaspora community. If you're an expert in an area, particularly in the healthcare industry, you're a doctor, you're a nurse, and you are knowledgeable, this is a chance for you to contribute to your community. And I think that's important to underscore. In other words, if you're going to hospital and people are scared of going and never coming back to see their loved ones, surely it is our responsibility now as professionals to step up and try to, as best as we can, help our community navigate through this. So again, as I thank Mary Ann, Sally, and Pula for doing this, Huda, I want to bring you in again, give you a take, and also as you make an appeal to our professionals within the community to step up.
Thank you so much, Dr. Okari. I really want to go back to what Dr. Menge said earlier in terms of, this stigmatization of that we have as Black people, as immigrants, right? Because when we go, most of us do not seek care because of just that, and so my goal is to really bring in people from within our community who are experts in these areas, so that when we encourage our community to seek help, we already have people that look like them, people that talk like them, people that understand the cultural context from where they're coming from. And so what my team and I are doing is engaging the county, the state, in terms of how can they provide resources to our community to provide training, to utilize those experts in the healthcare field, because majority of our people, again, are in the healthcare field, to come in and get trained in terms of providing these resources. A good example is that in our COVID-19 testing yesterday, I talked to one of the county representatives, and they stated that the city of Minneapolis offers training for COVID testing members of the community, so that they can also provide their own testing to the people that they serve. And so that's something that we are proactively looking at. And I'm appealing to all of our healthcare professionals within our community to step up. And you don't have to necessarily be a healthcare professional to get this type of training for COVID testing. But if we can have our healthcare professionals step up and volunteer their resources, they volunteer their knowledge, they volunteer their time to come and provide search services to our community, then we will definitely see a large number of turnout in terms of, when we are calling for COVID testing, people will come because they trust in who is providing that care, because the person who's providing that care looks like them and understands who they are, their cultural context, and are comfortable to really say, hey, this is how I'm feeling. This is why I want to get this. Can you provide me guidance? And we have to also be mindful of the demographic of our community, right? Like, we have people who have health insurance. We have people who don't have access to health insurance. So providing information in terms of what is available for those who have health insurance and for those who don't have health insurance, as in terms of if you are undocumented, because there are resources out there for those people, and that category of people are scared to come seek that help that they need. And so providing those resources within our community and creating this environment that is welcoming to everybody, no matter their status, I think it's critical. And that's a great sign of, providing that environment where people can come in and seek the help that they need from the people that look like them, that talk like them, that understands where they're coming from.
Talking about that, Madam President, we have one who looks and sounds like us, and one of the questions from the audience there, Ben, if you don't mind bringing that question from Collins. I don't know, Dr. Menge, if you're in a position to, I know we're going to have more segments in the future, so thank you. Please keep on putting those questions there. We'll have another segment later, but Dr. Menge, you see now this is a chance for people to really get from one of our very own. Are you in a position to quickly give us that quick breakdown? Dr. Menge, can you please walk us through the infection cycle till the lungs collapse? Are you able to quickly?
Sure. So one of the interesting thing about viruses is that they just take the same form. If we understand the life cycle of HIV, I would not necessarily compare one-to-one to COVID-19, but I would, for the data that we have, it does, once someone coughs and the droplets land on any part of your body, let's say, like the respiratory system is very, I wouldn't say fragile, but it's very, it's the softest and very delicate part of the body. It does have very thin membranes and the epithelial cells there. I don't want to go into the science of it. So what happens is once the droplets that contain this virus latches on to the cells in the body, the virus itself gets into the cells, replicates itself, and then it blasts, larger molecules or larger other baby viruses. And once that happens, the biggest thing it does, it starts targeting the immune system. And one of the biggest things that we get when our immune system is low is that, all the various infections that we have, any underlying problem will surge up. So, so it starts in the upper respiratory tract, and then it does start rebuilding itself, affecting the cells in the area. And for example, if someone has, for instance, asthma, a person with asthma already, their respiratory system is a bit compromised. So that is, it's going to give a chance of that virus to replicate itself and rebuild itself. So anyone with asthma needs to have their asthma very well managed with their doctor and their pharmacist. So, just the lungs will collapse at a time where if there's no system that's going to help it withstand the effect and the heaviness of what the virus is bringing to it. Am I clear on that? Like, just to bring this up, it's better to bring a diagram, which is going to really go into the nitty-gritty of how the virus is replicating itself, and then it's just recreating itself within the cells in the upper respiratory system, and then that leads to the breakdown of to the necessary follow-up of the severity of the disease. But one big thing is, if someone knows what to do, goes, sees the doctor, and their doctor is helping them through the process. I know there's no medication, but they can show you some self-care ways of helping yourself. Something I wanted to bring up at some point was that I participated in, I volunteered in a program in Iowa while I was in Iowa for school, where we created, I was able to translate some of the instructions on how to do self-care into Swahili. I mean, this was a big test for me because I haven't spoken Swahili in a long period of time. So some of the patients who were to self-care or self-treat at home were given some equipment like the blood pressure, because one of the things that shows that there is, the progression of the disease was changes in the blood pressure. And also they were given a thermometer to check on your temperature. And then from there, you would do a telehealth where you visit with your doctor through, through a gadget or your phone, like just to visit with your doctor through telehealth, and that would help you keep in touch and on track with yourself. Visiting or visitation to the emergency care was strictly restricted to the people who were either super sick, the elderly, and to those who they felt like really needed the help right away. So with that, I hope I was being helpful, but creating that instruction is just a show of like, if you don't understand the English language, there's always going to be information out there. The pharmacies, they said the pharmacists are the most available doctors you can reach out without having to make any co-pays. So go to the nearby pharmacist or pharmacy, Walgreens, CVS, and talk to them about the symptoms you're facing. And they do have translation gadgets, or they can reach out to the system to get a translator for you to be able to translate some information. So this is really building up on the self-responsibility, people taking up responsibility for themselves and doing the necessary steps to protect yourself. When you protect yourself, like what they say in an airplane, take care of yourself first, and you're able to take care of somebody else. That's just what I'm going to bring up on that. But yeah, I can bring or put up a really nice presentation much later on how the disease recreates or like develops itself.
Dr. Menge, we'll create an opportunity for you to come and do that. And by the way, that's why you see One Voice Consortium working closely with us. What we're trying to do is to bring the very best of us, experts in different areas, so that they can come in and do the presentation. I think if you watched the show we had on Friday with Professor Ndiangui down in Florida and Tony Opande in Texas, we're talking about male feminists. Those are experts within the community who are bringing these concepts and really making them understood to our community. So we'll create that opportunity for you and many younger people like you who can explain these things better for us. Now, as we get to the last segment, I'm going to bring in Sally. Sally, if you don't mind, you are a triage nurse. What is a triage nurse? And then make the contributor the same question as the leaders going forward. What are the lessons learned from here?
All right. Dr. Kari, a triage nurse is a frontliner who receives the patients first. Our major job is to do the assessment, the screening, and then we determine who needs to be seen first by a provider and guide them or direct them through the risk assessment and the person to contact to next as the doctor are lined up to see them. So our basic assessment that we do is screening them. So we do prevention of the disease, promotion of health, and control of the condition by doing risk assessment first through screening. So that's what we do. And then once we hand them over to the provider, we seen first or next. And then we do treatment, and then later on we do the management of the existing condition. Dr. Kari, it's very, very important to note that there is a very controversial topic that has been discussed previously about PPEs, personal protective equipment. That discussion came about once the disease or the virus came up. So we have different kinds of PPEs. We have a cloth mask. We have a hospital one that we use as healthcare providers. We have a very, very important one. It's called the N95. And then we have a face shield. Okay. So these are samples of personal protective equipment, in addition to the gown and gloves too. So in the community now, we have an order or a very important recommendation through CDC to put on a mask wherever you are in the community. This is one of the most friendly equipment that is needed everywhere, whenever you go. So we need to note that a mask cannot protect you from catching the virus, but it can help prevent people who have the COVID virus from spreading it to other people. Like Dr. Menge mentioned, the droplets, the coughing, the sneezing. If it lands on your mask, you are able to, not inhale it directly or breathe on it, okay? So, and it also prevents it. If you have the infection, if you have been exposed, it stays within you. So you're controlling it from spreading to other people. So CDC recommends a face mask in public setting, in social areas, because it lowers the risk of spreading the condition. So, and also infected people and asymptomatic people are not able to spread it through the droplets. So let's go with an impression that we need to protect one another. We need to pass a message of positive living, because guess what? Most of us, we adjust. Studies show that we adjust with changes that happen. At the beginning of introduction of a mask, many people rebelled. They didn't want to wear a mask. Now, this is a very friendly equipment. We love it now. We can wear it anywhere. I'm even comfortable wearing it for 12 hours because I've adjusted to it, and it has become one of my, equipments that I cannot avoid. Even in the house, I find myself wearing it, putting it on. Okay, so we need to talk about COVID-19. That's when our friends or our family members can adjust to it. Most importantly, we need to talk about the measures. One of the very basic measures that we need to talk about is hand washing. Hand washing, covering the mouth, the nose, and preventing ourselves from, touching the nose and the mouth, because that's the entry of the virus. We need to get enough knowledge. Dr. Menge said we need to get enough sleep. We need to get enough rest. We need to hydrate ourselves. Let us not forget to drink, but because once we have the mask on, most of us forget to drink, because without a mask, you find yourself drinking, all the time. But covered with a mask, you will tend to forget drinking water, drinking a fluid that will hydrate us. And research has shown that if you have it in the throat, you're breathing it through the nose, you have it in the throat, you will drink the particles into your stomach. And some people have had symptoms of diarrhea. So you are expelling it, okay? So it's very, very important to boost our immunity by drinking. And I'm sure Dr. Menge and the rest, and Biola and the rest of the experts here have more to add into that.
Thank you, Sally. You always give us very good insights. I think it's true that human beings per se are masters of environmental adaptation, and I think we can adjust that. As we run to the end of the show, and we're going to have another segment later, so just out of time, we're going to finish up here momentarily. Phil, I want to bring you in. When you put all this in perspective and in context, and as a community, what lessons do we draw from this pandemic?
One of the first lessons that I think of that we can draw as a community from this current situation is that we look back at what is one of the biggest values in our community as Kenyan in America or in Europe or even in Kenya, no matter where you are in the world. One of the biggest values that I think we have in our culture is community. And I think no matter what the occasion, whether it's for church, for graduations, for holidays, for matangas and funerals, weddings, really for any occasion, we love to come together. That's crucial to how we interact to our Kenyan society. And so I think this pandemic has really hit home for most of us in 2020 who've had to miss some of these crucial, critical moments just in our lives. And so one thing that I want to just harp home is at the end of the day, because we care so much about our community, this is something that, you know, although all of us have had to sacrifice a little bit, we still need to hold on to just that sense of sacrifice just for a little bit longer. I don't know how long this is going to take to, you know, grapple and really come to terms and address COVID and kind of get over it. And I think it's important when we look at the future of our community to really to use that as fuel in order for us to kind of have more energy to keep doing what we've been doing. I know after 9 months, we're all kind of tired of socially distancing ourselves. We're tired of, you know, the kind of in the back of our head, the voice that we have whenever we leave the house. We're tired of wearing masks. But, you know, as much as work as we've put in, just continuing that energy and continuing to think about, you know, our community as a whole. So a year from now or 2 years from now, or however long it takes, we can look at our community when we're able to actually come face to face and continue and resume the life that we had before the pandemic, and that we can see as many people as we started off this pandemic with together with us after we're done with this pandemic. And so that's at least what I use as solace to, you know, every day wake up and continue doing what I need to do to feel safe. And secondly, the other lesson I would take away is that there's, you know, unfortunately, a lot of inaccurate information about COVID out, you know, especially through social media sources. And so I would, you know, recommend at any point in time, check with official sources for up-to-date information, whether that be the CDC if you're here in the United States, whether that be the NHS in the UK or the World Health Organization or whatever country you're in. Just check with the official public health resources and public health institutions, and of course your own providers. And just like Sally has said, wear a mask. And, you know, when you look at masks, I have my example here that I have right by my desk, you know, not wearing a mask like this, not wearing it like this, making sure your nose and your mouth is covered. It kind of defeats the purpose if you aren't covering both. Number two, just like Sally said, washing your hands, especially when you're coming in and out of your house and when you're engaging with others. And lastly, of course, social distancing yourself from others as you go out to the grocery store, as you go out through your day. Of course, we don't expect everyone to just stay at home every day. There's parts of your life that you need to live outside of the home. And so just being really cognizant that, you know, just because you have a mask on, that doesn't absolve you of any other things that you should be doing to protect yourself and protecting others. And I think, you know, at the end of the day, I try to remember the thing that you must remember with COVID is that for the most part, you can't tell who's infected. When you're in a crowd, you can't say that person has COVID, that person has COVID. And so those people should wear a mask. And so there's a lot of asymptomatic people. And so it's super important that everyone that can wear a mask does wear a mask in order for us to continue keeping our community safe. And so those are, you know, some of the lessons that I definitely take away from this conversation and as a whole for the last, you know, 9+ months that we've been dealing with this.
You have no idea how much you impressed. Thank you. And then Dr. Menge, I want to bring you in as well. Put this all in context of, well, that's fine. It comes on and it goes. But what are the lessons that we as a community should draw from here?
Add on what Sally, Dr. Viola has mentioned, and also President Hilda, it's you know, let me just add on, to wash your hands, it needs to be for 15 seconds. Sing the whole happy birthday song when you're washing your hands. You know, don't go, you know, excessively washing your hands, but, you know, if you're constantly on the front line, especially healthcare providers or whoever, you know, there are some who are not really healthcare providers, but they're support system to healthcare providers. People who do housekeeping in the hospital, like they are doing a big job of trying to clean the hospital to reduce the amount of some of this bacteria and viruses from taking precedences in the hospital. Did you know that some patients who are hospitalized sometimes get sick from some of the bacteria and viruses that are prevalent in just the hospital area? So we can, you know, this is we can look down on some of those important personnel like the housekeepers, but they do a very big job. I just wanted to add on that. But wash your hands constantly, as constantly as you feel is going to be helpful for you. But this has just been a test of measure for our connectionness as human beings. One of the things that I mentioned earlier is that human beings, one of the basic needs is connection. But this has been a test of our connection to a higher level, in that we need to stay away in order to protect ourselves and protect our family members and other people from catching the disease. And staying away was just to give the healthcare personnel time to actually do the research that's necessary to help us, get back to our normal systems. Like economy in various countries are breaking down, so it was at a low cost to them for them to have people go home. So we need to be very thoughtful and thankful for this opportunity that's happening. And also, it's unraveling of something that has been happening already. People have just been living a stressful lifestyle, and with stress, that's how the prevalence of all other diseases come up. So staying home and taking that step to reorganize your life and see how well you can take care of yourself has been an opportunity to learn from this pandemic. One other thing is, how accountable can someone be for themselves and for other people? So with that, it's just and especially bringing to light that some of the COVID testing has not been free. I am so thankful to President Hilda for putting up this opportunities to actually do the free the free consulting and also testing of this, because personally at some point I was afraid if I didn't have an insurance, where would I go? My workplace would send me to do that, but I don't have an insurance and I cannot go up and tell them that I don't have an insurance. Sometimes $40, or I don't know how much that is in Kenyan amount, can be shipped to other people, but someone may not have that. If they have to compare between purchasing the next meal and actually having the COVID-19, I would go for taking care of my stomach first to get sustained. And so that's how, when people prioritize things in their life, it tends to gravitate towards what is, if people are in survival mode, it's going to gravitate towards what is going to help me survive. And food is one of the fundamentals. COVID-19, possibly someone can say can wait, but it's important to go in and maybe on the website we can provide information on where you can go apply for this insurances. And some of the most vulnerable population now is maybe someone who had just come from Kenya or just immigrated to the country, and potentially they're home, they haven't applied for it. I mean, for most people who immigrated to Kenya, from Kenya to here, you might be in that position. You can relate to what was happening in between the period when you got acclimated to the United States. What was happening, you were solely dependent on the people who are hosting you. So I'm reaching out to the people who are hosting those who've just come into the country. Please take care of them, help them apply for these resources, and be as kind as you can to also guide them around, so we are not leaving people untaken care of, or we are responsible for them. If not, then send them to the right resources where they can get the help they need. Outside of that, I will just always say it's just a responsibility for everybody at this time. Pull out from whatever knowledge that you've learned and go out and provide this to everybody. So thank you so much.
Impressed. And I think those ones who are watching this, you can see why our community should and must be so absolutely proud of our ladies. And I think, Hulda, before I make my closing statement, can you bring this home for us? Really, what lessons do we learn from this? As a president, obviously, you receive a lot of texts and calls. And to the wider community, there are people watching, obviously, here in the state of Minnesota and across the country. And interesting, I'm watching on the commentary there are people watching me from Africa. From this experience, what lessons should we draw, really?
So for me, again, it's a privilege to be a part of this group of very well-educated young ladies who are bringing in their knowledge. But the biggest lesson that personally I've learned is that our community, we are reactive instead of proactive, right? Like, we wait until we get to a situation, that's when we react. And my goal really, and my team's goal here at Mwanyagetinge, is to work ahead and plan and strategize to address the needs and the challenges of our community before we actually get into situations. So with COVID-19, personally, I think we are running late in terms of addressing the needs of our community. And yes, there's still a lot that we can do, but if we are proactive and planning ahead and strategizing and having strategic partnerships, not only with other nonprofit organizations that are doing this work, but with local, state, and federal government agencies that do have resources, and knowing how that process works is critical in really getting the needs of our community met. So that was one of the biggest lessons that we are learning with this COVID-19. Secondly, it's not necessarily a lesson, but it's a proud moment for me, for our community, in the sense that I have seen our community step up and find creative ways to make it happen, to care for our people and family unit. And I've seen people coming together, to collaborate, and to work together with other people in order to support those of us who are struggling with this pandemic. And lastly, I want to encourage our community to find more ways to connect with each other. I think we all emphasized on, the Kenyan community being this collective, and we love getting together. That aspect of togetherness is critical in our well-being. For example, for Matangas, we love to get together for a whole entire week to console with the family. For weddings, we celebrate a couple of days together, and that has been taken away from us. And that definitely has taken a toll in our well-being, both physically and mentally. And so encouraging our community to find creative ways to connect, whether that is through technology, whether that is whatever way you can find a way to connect, is critical and important for our well-being of our community. So I definitely want to emphasize on the partnerships and the collaborations we have created across the board. And like I said earlier, my team and I are working together with the county, with the state, to bring in the resources by our own people, so that, our people are not afraid of coming and getting those resources and getting that information out there to our community. And lastly, having conversations like this with our very own bright young minds, and also experts within our community, having such dialogue and collaborations and conversations and bringing accurate information to our community is critical. And obviously, thanking KDR TV and their partnership in allowing to have this platform to do that is very important. So that's what I would like to close that.
Well said, Madam President. I think with that will mark the end of a very intriguing conversation, and I can't thank you, ladies, enough for what you've done here. By the way, as you are talking, one person who just came to my mind, and I apologize for giving a big shout out, is Pastor Liki Nyamberi. So Pastor Liki Nyamberi wrote this book, Moving Beyond Mediocrity. And I encourage people, he didn't ask me to say this, but I encourage you to buy that book and read it, Move Beyond Mediocrity. I think for a long time within our community, we've been so focused on trivial issues, things that really don't matter, things that just contribute to our downfall collectively as a group. And I think what is evidenced here today with these extremely brilliant young women is that whenever we come together and focus on the positive sides, we can bring the very best of us. And if we do so, I think in the near future, in the next 5-10 years, we can do big things. And I think, Pastor Liki Nyamberi, a big shout out to you. Thank you for writing that book. And for our people, read that book, Moving Beyond Mediocrity. As a people, let's move beyond mediocrity. Let's focus on positive things that can bring us together. And think, as you see these ladies here, surely, unless something is not right with the mind, this is some of the best of us. And I think if we do this, I think we can go places. So again, I want to thank you, panelists, for coming on. Dr. Menge, thank you for your very insightful contribution. I think we brought you to the national level now. Don't hide. We'll make sure we bring you. Luckily, you don't live very far away from me. We'll get you back on the show soon. Salia Teke, as always, you do a great job for us in the community. Thank you. Keep doing what you're doing. Just know we don't call you all the time, but just know that we so dearly appreciate you and the good work you do and your family. Pila, first time on the show, I can tell you for sure, I'm so proud of you. I know your parents, wonderful parents. They're some of the parents, they're the first ones in the state, as Kenyans. And I think they laid a very good foundation for us to be where we are. I think a big shout out to them as well. And your contribution here today has been absolutely massive. Madam President, I can't thank you enough. First Lady, President of the organization, I think you're doing incredible work trying to bring all the African immigrants here in the state of Minnesota together so that we can do a good job together. Keep doing it, and I will assure you for sure that KDLTV will be a good partner for you going forward. So again, many thanks to you. I also want to thank especially the Kenyan community. I know people watching across the country, thank you, but especially the Kenyan community here in Minnesota. I think we've come together in ways that I've never thought before. Let's keep coming together. Let's show the world that when we come together, we can do big things. Again, many thanks to you from here at KDL TV. I also want to thank the unsung hero of all this. I think we don't say this, but I'll keep saying this. The unsung hero is the man called Bernard Kebuato and Collins, the son and the family. Is the person who provided this platform from which we're working. So I always keep remembering this. The very unsung hero is Bernard Kebuato. Thank you, Bernard, for all you're doing. You don't know how rewards come. God is watching, and I'm sure you'll be very handsomely rewarded. So on behalf of the entire team here at KDL TV, from our families, and of course the panelists who share that to you and your families and to the extended African immigrant community here in the US and elsewhere around the world, we wish you a very happy holiday, Merry Christmas, and Happy New Year.